About 10 million people in the U.S. have peripheral vascular disease, and it's the leading cause of disability among people older than 50 and those with diabetes. We spoke with Dr. Subbarao Myla and Dr. Jacques Kpodonu of Hoag Memorial Hospital Presbyterian in Newport Beach about the latest treatment for PVD.
Peripheral vascular disease. So it's a condition where the arteries in all our body have developed blockages. So the organs that are fed by that artery is no longer getting the oxygen and the nutrients from the blood. So peripheral vascular disease is a short term for a silent killer.
What causes PVD?
PVD causes are easy to remember. Same thing that causes the heart disease caused the PVD. The heart disease and the PVD are the two inseparable and invisible twins. So, smoking, high blood pressure, diabetes, any of these conditions that someone has with a heart disease, peripheral vascular disease also will be there.
We ask what the symptoms of PVD are.
Peripheral vascular disease has extensive distribution in the body. So unlike the heart, which is one organ only, depending on which part of the body that artery is affected, you will have different symptoms. But in a nutshell, if the arteries to the legs are involved with PVD and they have severe blockage, they typically get pains in the legs. But if the PVD involves the carotid artery, it's a completely different picture. They can have a TIA, the warning signs of stroke, or a full-blown stroke as the first symptom. And in the very elderly, when the grandma, we think, is slowing down, having dementia, in reality she's having mini strokes and part and parcel of the brain is knocked out, so eventually they get dementia. That could be from blockages in the arteries. If you see your doctors examining the pulses in each and every part of the body, both the hands, the brachial arteries, the carotids, and then the groin, popliteals, and in the feet. PVD is diagnosed when the pulse is weak, and they confirm that by checking the blood pressure in the arm and in the leg. Normally the leg blood pressure should be higher, but if it is lower, then you know you have PVD.
How is PVD treated?
A vast number of the PVD patients can be treated. For example, if we discuss a circulation problem in the legs, vast majority of the times we encourage them in a vigorous walking program, and a combination of medications is sufficient. The non-surgical means are the standard of treatment.
Well, we have a very comprehensive team of vascular surgeons, cardiac surgeons. We have cardiovascular medicine specialists, and then we have a whole array of diagnostic tests. For involvement of the arteries of the legs, we offer surgery. We also offer the stents. We also offer new technologies, which includes laser therapy for peripheral vascular disease. We also offer what we call atherectomy, where we can go in and remove the plaque from inside the vessel. So those are all new technologies which are really cutting edge and which are available.